Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Trudy L is a 29-year-old female patient who initiated care because she feels like she has no energy. She just had her annual wellness examination, and her primary care provider told her that she is in excellent health. Because she complained about this excessive fatigue, her primary care provider performed a complete blood count, comprehensive metabolic panel, urinalysis, and thyroid function test, and told her that, along with her physical examination, everything looks normal. Further discussion reveals that Trudy is having some relationship challenges with her boyfriend of 2 years, and this seems to be spilling over at work, where she is having persistent conflict with her supervisor. Ultimately, the psychiatric mental health nurse practitioner diagnoses Trudy with major depressive disorder, mild single episode. The psychiatric mental health nurse practitioner and Trudy discuss treatment options, and Trudy would really like to try non-pharmacologic interventions. Which of the following represents the best approach for Trudy? A. Family therapy. B. Behavioral therapy. C. Psychoanalytic therapy. Or D. Interpersonal therapy. From among these choices, D is the best answer. Family therapy is just not regarded as a primary therapy choice for major depressive disorder. While some data suggests that it may prevent relapse by lessening stressors, it's not the best choice from among the options presented here. And of course, relapse prevention is different than achieving remission. So first, Trudy needs to achieve remission and then worry about preventing relapse. So family therapy is not the best option here. There are also limited data on the efficacy of behavioral therapy for major depressive disorder. Behavioral therapy has a strong body of evidence primarily for behavior change for patients that identify particular aspects of their behavior, their approach to the world that they want to change. And in that circumstance, behavioral therapy can be extremely helpful. But to manage a major depressive disorder, it's certainly not a first-line therapy. Psychoanalytic therapy may be helpful for depression, although it is typically a very long process and not practical for acute symptom management. Psychoanalytic therapy, remember, is that Freudian perspective where the patient typically commits to therapy for a period of years, and it really is very introspective, going back into childhood, and frankly, overkill for a patient with a major depressive episode, single episode, mild. It's really just too much for that. Interpersonal therapy has a body of evidence to support its efficacy for major depressive disorder, and it may simultaneously help Trudy with her current relationship concerns, both with her boyfriend as well as her relationship with her boss at work. Interpersonal therapy is a goal-oriented program. It was originally designed to be time-limited and practical, recognizing that the vast majority of patients that come to therapy have neither the time or the financial resources to engage in a very long, time-intensive therapeutic process. So interpersonal therapy was developed to be time-sensitive. It is a very goal-oriented program constructed of typically between 12 to 16 sessions. I mean, there is certainly room to vary on either end of that, but on average, the point is it's meant to be time-limited, relatively brief, 12 to 16 sessions. So it makes it more practical for Trudy. It makes it more attainable, and really a very appropriate approach to a major depressive episode, single episode, mild, when the primary manifestation appears to be how she interacts with others, and the relationship seems to be a primary stressor.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.